our special items. The first special item we have is a report and a recommendation from the Employer Retiree Health Insurance Committee. Mr. Espiritu.
Yes, the Retiree Insurance Committee had a lot of productive discussion over the last few meetings. Unfortunately, we do not have a recommendation this evening. However, we do have a representative from the committee that would like to say a few words.
Good evening. Mike Thomas. I'm with the Firefighters Union. I'm just going to read the statements for time reasons. But please know we are and have worked very hard on this, and hopefully will continue to, depending on council action. Thank you for your patience regarding our report. We have been given a very difficult goal to phase out non-bona-fide retirees and their dependents from any sort of subsidized health insurance. We want you to know that we have taken this process very seriously. We also believe that this task is not one that can be easily dealt with. The GATSB 45 is an accounting standard that includes the quantifying of the unfunded liabilities associated with retiree health benefits. The unfunded liability is actuarially determined by the normal costs or current year costs of benefits and the unfunded costs of retiree health costs over a period of 30 years. We have asked many questions with regard to the GATSB 45 number, which is out there as $29.4 million, representing a 30-year unfunded liability. And we've had some specific questions with regard to that number, such as what did the change over the summer, June 29th letter, that revolved around current employees and their retirement health benefit. What did that change due to the GATSB number, as an example? Further, the current retirees in next year will have a larger deductible and a larger out-of-pocket. We would like to see how that would reflect against the unfunded liability number as well. And then, and there's many other questions that we have out there, but in the EPI report, it talked about a pre-funding mechanism for retiree health benefits. And should that be adopted or put in place, what would that do to the number? So we've got some questions out there that are difficult to answer for Rudy as far as a quick answer, a quick response. So we're hoping that we can have a little time to get some of those answered. I know you've heard some of the history regarding this issue, but please note that it wasn't the employee groups that initiated or left the supplemental health insurance issue for retirees unnoticed. We have seen for the last 15 years what our insurance costs will be at retirement, which gave the employees the opportunity to financially plan for those expenses, giving us an opportunity to save for those costs. While we understand the vision to decrease expenses, we ask that you give us more time to get creative on an acceptable health insurance plan that will limit the cost to the city taxpayers and the impact to our retirees. If the council feels compelled to make a quick decision, please decide on the plan that will least impact our retirees. They're on a fixed income, and plan design changes for next year will increase their costs. So we're hoping we can get a little bit more time. We've scheduled a meeting pending council action, so we're ready to go if we're green lighted. So thank you.